Hold up.
I hope you're having a great day and I hope you're staying safe at home. Well, there are millions of people who go through the unfortunate uh, procedure of having their gallbladders removed at some point in their life. Prevention is always better than cure, but if you are one of those people who have had their gallbladders removed surgically, there is a particular way that you need to live post your gallbladder removal. Okay, you can come back to a normal life. That's not a problem at all. But if you continue to abuse your digestion and you continue to abuse your body, okay, these problems are going to become more and more severe in your system at some point. So we need to understand that the gallbladder is like a 4-inch organ that's connected with your liver. The function is bile. It holds bile that's produced by your liver. If you have your gallbladder removed, you don't have an issue with bile. It's just that your liver will now produce that bile directly into your small intestine to break down fats and fatty acids in your body. The importance of bile is to break down fats and fatty acids. That's why a lot of people with their gallbladders removed have a problem of digestion. They feel nauseous. They get very acidic when they eat larger meals, or they eat meals which are high in fat, like fried and deep fried and all of that stuff. Post the removal of your gallbladder, you need to understand, number one, you got to go easy with your diet. If you want to heal faster and if you want to resume to a natural and a normal life as quickly as possible, the first thing you need to do is go easy on fats, on junk food, on processed food, particularly fat, because your body's been used to your gallbladder squirting out the bile whenever it's needed to break down your food. Now your liver's going to do that job. So you need to understand, if you put more fat in your body at that particular point, you're going to put a lot of stress on your overall digestive system, and that's going to result in acidity, a lot of burping, nausea, maybe even constipation, and a whole load of other problems. So number one, go easy on your fatty foods. I'm not saying that you shouldn't eat them, but you want to eat very, very small portions. Usually I'm not a fan of eating every 2 to 3 hours, but if you're recovering from a gallbladder surgery, you want to break down your 3 main meals, if you're eating 3 main meals, into smaller meals, so that you don't overburden your digestive system. So have smaller meals until your digestive system gets a little bit better. You want to cut out white sugar completely for at least a month post your surgery. You can have jaggery if you're not diabetic. You can have jaggery, you can have raw honey, you can have stevia. That's not a problem at all, but cut out white sugar completely. Processed food, because processed food is devoid in fiber. And in fact, the diet to help you recover quickly should contain a fair amount of fiber. So you want to stay off processed and junk food and really get back to your home cooked meals as far as possible. For better digestion, stay off dairy for a while. Direct milk. So I'm talking about lactose. So you want to keep milk out of your plan for at least 3 weeks to a month. If you've been used to having yogurt, you can have that. That's lactase, so that's more easy to digest. But preferably, we like to keep our patients off dairy completely for a month and then slowly bring in the yogurt and the buttermilk. And if they're okay having milk, then we bring in milk later. So you want to be careful of dairy. If you're non-vegetarian, you want to stop red meat immediately. Immediately, you want to stop red meat. Okay, you want to choose meats, leaner meats like fish and chicken. Again, very, very small portions. Okay, caffeine and alcohol. Okay, because we know that caffeine, whenever we drink caffeine, we automatically make our stomachs produce more stomach acid, which isn't the best thing to do when you are recovering from a gallbladder surgery. So these are the main things to do. Now, what kind of diet can you have? Honestly, it's a very, very balanced diet, one which has a lot of fiber, but don't overdo it on fiber. A lot of people overdo it on fiber and create more gut issues. If you're eating your fruits, you're eating your vegetables, you're getting your dals, which is your lentils, your legumes like your rajma, your chana, your cowpeas, your whole grains, which will come in from good sources, not white grains. I'm talking about whole grains. You can do your jowar, you can do bajra, you can do amaranth, you can do rice mixed with a dal, so that's like a khichdi. That's like a complete protein that you can do. You can do nuts and seeds. All nuts, all seeds are allowed unsalted. Okay, like I said, in case you're non-vegetarian, you can have egg, but you want to have 1 egg every alternate day, because you need bile to break down the fats in eggs. It's a great food for you, but you want to go easy when you're recovering from your surgery. You can have a little bit of chicken and fish if you're non-vegetarian. You want to stop refined oils completely. Completely. You should not be having refined oils. There's a reason why refined oils are so cheap in the market and affordable, so we would lean towards buying a cheaper oil. But please understand, they are so refined and it causes so much of inflammation in the body. If you want to take care of your health, it's better to invest a little bit more money in your cold pressed oils, or just make pure ghee at home, and you can consume that in small quantities. But again, if you're recovering from a gallbladder surgery, take it easy on your fats, small portions. When you've just finished your surgery, you may want to start off with a liquid diet for 2 to 3 days. And as you find your digestion getting better, you can move into semi-solids. And as you find that getting better, into smaller meals, try to be vegetarian. You know, I would really suggest that you try to be completely vegetarian for at least 2 to 4 weeks. The healing will be way faster. Do not be sedentary. If your doctor's allowed you to work out, you want to do a little bit of walking around, because remember, the more we exercise, the more blood circulation we have. Flowing blood or circulating blood carries nutrients from the food that you eat and oxygen from the air that you breathe to every cell in your body, helping you with recovery, helping you with lowering inflammation. So exercise is required for your healing and your sleep. Always remember, post-surgery, or even if you don't have a surgery, everything in the human body heals only in the presence of deep rest, which is sleep. So if you want to recover quicker, you got to make sure that you get your sleep in order. So these are the few things that you can do. Do not get worried. You know, a lot of people do not need gallbladder surgeries. Work it out with your doctor. See if you can change your lifestyles, and if you can work with them, good. But when you need it, you need it. It's as simple as that. But make an informed decision. You can live a normal life, a normal quality life, without your gallbladder. So a lot of people, you know, their gallbladders are distended, filled with stones, and they're just like, I don't want to do the surgery, I don't want to do it. And there are 10 doctors telling them to do it. So if you have to do it, you have to do it. It's as simple as that. But change your lifestyle. To prevent gallstones from happening in the first place, it is purely your food habits. The kind of salt you eat, the quantity, your fats, your refined oils, your exercise, your sleep, your stress levels, cholesterol, all of that stuff. You got to remember that bile is also important for cholesterol elimination from the body. So sometimes when you remove your gallbladder, some people's cholesterol levels go up a little bit. Don't worry about it. Maintain your lifestyle, they'll come back down again. In most cases, you do not need medication, but check with your doctor. Always check with your doctor. Tell your doctor, I am changing my lifestyle. I'm going to change the way I eat, the way I sleep, the way I move, lower my stress levels. Give me a month. And then go back to him in a month, and if your levels have come down, your doctor won't medicate you. Have a great day, have a great week, everyone. Until next time, eat smart, move more, sleep right, and breathe deep.